So it basically was the smoking of cigarettes that, over time, I started smoking when I was 16 years old. So over time, and then not doing as good a hygiene, I didn't brush my teeth 3 times a day, sometimes not even twice a day, at least once a day, but it wasn't enough. It didn't floss enough. And so I ended up with a lot of gum loss and also bone loss over the years. And then my teeth started slowly, one would come loose and come out, or I'd have an issue with one and have to get it pulled.
So Paul is another one of those patients that came to us with some pretty significant dental needs. And when people come to us, we're always looking at, how can I help you? What are your issues? And Paul had a situation where he had a lot of advanced gum disease and bone loss, mobile teeth, and teeth that couldn't be saved. After
a while, I only had 8 left on the top, and I was missing another one on the bottom. So I was minus 9 teeth. I ended up making an appointment with Dr. Kramer, and went in and saw him, and he did all the x-rays, looked at my mouth, and he started going over what the possible options were. And for me, he wasn't able to do just like one tooth here and one tooth there, because my jawbone had deteriorated enough that my only option was either have them all extracted and get dentures or do the dental implants.
So in Paul's situation, when we evaluated his mouth, we noted that he had teeth with significant disease. And when someone is unable to save their teeth, or they're in a position where all of their teeth are going to be removed, then we talk about the options of either removable appliances like traditional dentures or permanent fixed implant retained teeth, which is what Paul chose.
In talking to Dr. Kramer and consulting with him about my teeth, we decided together that the dental implants were the way to go for me. It was definitely the right decision. I feel a lot more comfortable around strangers, talking and not worrying about whether you see my teeth, or not worrying about laughing out loud and having my mouth wide open laughing. It just gives you a lot more self-confidence. And so now that I have my new implants, I can eat corn on the cob, I can eat steak, I can bite into some taffy without having any issues. I can eat corn nuts. That's something you don't want to eat if your teeth are falling out, let me tell you. So, yeah, it was a huge relief for me. And my family was all happy about it. The younger grandkids don't get scared. I used to be able to scare them. I would threaten them. If you don't brush your teeth, they're gonna look like this. So their hygiene's really good. So if you're having the feelings like you don't want to smile, you don't want to laugh, you're losing teeth, go see Dr. Kramer. He's got all the modern technology. It's literally painless. The extraction of the teeth, he pulls your teeth and he puts the new ones in the same day. I wanted something in there permanent, and that's what I got.